So my name is Dr. Debra Patt. I'm a Vice President of Policy and Strategy at Texas Oncology. We're a large private practice in Texas where we have rural and urban centers, cancer centers, about 221 sites of service, and we see about half of Texans with cancer. One of my responsibilities within the practice is I've helped us lift up telemedicine, which is a platform we've used for more than 5 years to do clinic-to-clinic consultations, really to reduce the gaps in clinical expertise that are brought on by geography across the state. So patients don't have to move. Instead, they can have telemedicine visits. Now, as you may realize, a certain portion of what we do is governed by payment policy, and some of it is just governed by compliance law. So the law has also changed to permit us to have new visits and established patient visits by telemedicine, and that's been meaningful. The other changes is that it doesn't only have to change at the federal level, but each of the 50 states has had to pass permissive policy to allow doctors in any given state to be compliant with their medical board to provide telemedicine services. So I practice in the state of Texas, and Governor Abbott has also been very permissive about allowing telemedicine services. Then the payment piece is complex. About 80% of our payers are governed under the jurisdiction of ERISA or under federal jurisdiction. So when Medicare has payment policy, frequently commercial payers will follow. But really every day, commercial payers have changed their payment policy, and so we get updates every day to date. Almost a month after the most comprehensive telemedicine payment policy was passed from CMS, some commercial payers have not yet liberalized their payment policy around telemedicine. So the constant flux is challenging to manage, and I'll talk about that. We'll put that aside for a moment. But of the 80% that are governed under the ERISA jurisdiction, what Medicare does and what commercial payers do that are federally, that fall under ERISA jurisdiction matter. At the state level, that's about 20% or so of our plans, and they fall under state jurisdiction. And so my state and Governor Abbott has been very permissive about having state policies to be more permissive of telemedicine visits and for state plans to pay for them, be they commercial or public plans. Now, let's go back to the commercial payers federally, because them changing every day and not being comprehensive in their coverage policy around telemedicine does matter, because when Texas Oncology or my practice or any practice submits a bill to an insurance company, if they change their policy a week later and it's retroactive, we have to resubmit that bill later, and it costs money. So them changing payment policy in the commercial payers frequently means that we're at risk for greater administrative expenditures if we have to resubmit claims over time. So what would be better, and I think in the best interest of patients during this crisis and moving forward, if commercial payers would be quick to act to have more comprehensive telehealth policies.